I'm here with my co-author, Dr. Lucy Harris, to discuss a recent AGA clinical practice update on GI manifestations and autonomic or immune dysfunction and hypermobile Ehlers-Danlos syndrome. And this was an expert review. Thank you, Lucy, for being here. Why is this review important to the GI clinician?
I think this review is important because it helps highlight hypermobile Ehlers-Danlos syndrome and recognizes that hypermobility causes more problems with GI symptoms. It's also recognized that hypermobility is associated with postural orthostatic tachycardic syndrome and dysautonomia. And a subset of these patients also have a form of immune dysfunction called mast cell activation. Currently, GI clinicians are really encountering more of these patients with chronic GI symptoms. And I think we provided important guidelines on best practices for identifying these patients, evaluating them, and treating them. So what do you think we've particularly highlighted in this CPU?
So this CPU is designed to help clinicians identify patients with hypermobility by introducing them to the Baton scale, which is pretty easy to implement in practice. It also discusses the diagnostic criteria for POTS, since we are seeing more patients with this, and introduces clinicians to basic lifestyle treatment strategies that can assist in patient care. And then lastly, it can help in assisting us understand the basics of testing for mast cell activation and recognizing when patients may need a referral and who we can refer patients to. And just to finish up, Lucy, do you have any final pearls that you want to add regarding the CPU?
I think, yes, I do. I think we need to recognize these patients have more motility disturbances and DGBI, and this will assist clinicians in the diagnostic workup and treatment strategies. Also, patients with EDS are more likely to have food intolerances and be at risk for restrictive eating. And so we can help get them to treatment faster by improving recognition of this.
Great. Thank you,
Andrea.
Lucy.